Welcome everyone to the first installment of the HealthLinks webinar series for 2025. It's great to see so many people joining us, and some of you know the drill that we ask you to put in chat where you're joining us from. So today is our first installment of the HealthLinks webinar series, supporting working parents and caregivers. We're eager and excited to get started with the discussion and to have you all here today. So thank you for joining us. Just a few housekeeping items as we get started here. All the participants for today's webinar are on mute. And we ask you to use the chat function for any technical assistance, any questions you have for using the Zoom platform. You can also use chat to tell us where you're from. But if you have questions for any of today's speakers, we ask that you put them in the Q&A box because some of your fellow participants today may also have the same question, and we can use the thumbs up button to vote on questions when we get to that section of our agenda. Closed captioning is available for those of you that need closed captioning. And if you need CEs, the survey should automatically generate at the end of today's webinar for you to collect those continuing education credits. And then finally, this webinar is being recorded. Everyone that registered and that is here today will receive a link to the recording of the webinar. A little bit about us. My name is David Shapiro. I am a white male in my late 40s. I have long brown curly hair and gray rimmed glasses and a brown beard. And I help direct HealthLinks, which is our public health outreach program at the Centers for Health, Work, and Environment. We are one of 10 national centers of excellence for total worker health funded by NIOSH at the CDC. And this webinar series is really our primary outreach strategy to reach as many people around the country as possible. A few notes from our 2024 webinar series, which many of you participated in. We had almost 4,000 participants in 2024 during our series from all 50 states in the US and from 20 countries internationally as well. So really appreciate all of you continuing to join us and the broad audience we have for these events. A quick disclaimer, the views and opinions expressed in this program are those solely of the speakers, and they do not necessarily reflect the opinions or the positions of our program HealthLinks, the Centers for Health, Work, and Environment, or the Colorado School of Public Health. And we ask you to engage with the webinar at whatever level is most comfortable for you. And as I mentioned, a recording along with key summary takeaways will be shared after today's event. We do always start with a land acknowledgement, and I will read that now. As we gather in this virtual space, we honor and acknowledge that the University of Colorado's 4 campuses are on the traditional territories and ancestral homelands of the Cheyenne, Arapaho, Ute, Apache, Comanche, Kiowa, Lakota, Pueblo, and Shoshone nations. Further, we acknowledge that the 48 contemporary tribal nations historically tied to the lands that comprise what is now called Colorado. Acknowledging that we live in the homelands of Indigenous peoples recognizes the original stewards of these lands and their legacies. And with this land acknowledgement, we celebrate the many contributions of Native peoples to the fields of medicine, mathematics, government and military service, arts, literature, engineering, and more. We also recognize the sophisticated and intricate knowledge systems Indigenous peoples have developed in relationship to their lands. We recognize and affirm the ties these nations have to their traditional homelands and the many Indigenous people who thrive in this place, alive and strong. We also acknowledge the painful history of ill treatment and forced removal that has had a profoundly negative impact on Native nations. We respect the many diverse Indigenous people still connected to this land. We honor them and thank the Indigenous ancestors of this place. The University of Colorado pledges to provide educational opportunities for Native students, faculty, and staff and advance our mission to understand the history and contemporary lives of all Native peoples. So it's my honor today to be welcoming 4 really esteemed colleagues and speakers. Our speakers for today include Dr. Lily Tenney, Dr. Ellen Galinsky, Tawny Espinoza, and Josh Leves. I'll introduce Lily first. Dr. Lily Tenney is the Associate Director for Outreach and Programs at the Centers for Health, Work, and Environment, and an Assistant Professor at the Colorado School of Public Health, where she teaches graduate courses in the Department of Environmental and Occupational Health. Lily's work focuses on implementation science. She has over 10 years of experience in dissemination and implementation, program planning, leadership, and strategic partnerships, including directing public health programs focusing on promoting worker health, safety, and well-being. Dr. Tenney is the co-founder and director of our HealthLinks program, and this initiative helps organizations identify solutions for worker health and safety. She's passionate about integrating total worker health with business sustainability, helping develop impact goals and planning for work, health, and corporate social responsibility. And as a mother of two, Lily prioritizes finding ways to support working parents. So, Lily, thanks for joining us and setting the stage today. I'll turn over controls to you.
Thanks so much, David. Welcome, everyone. It's great to see you and have such a large audience here today. I am bringing two people into the room today. The first is as public health practitioner, and the second, as David mentioned, is mother of two. I'm a mother to a 4.5 specifically, and 7.5-year-old. And so this is a topic near and dear to my heart. I've experienced now the ups and downs of all that comes with being a parent and working full time. So I was really inspired to host this webinar when I read the Surgeon General's advisory on the mental health and well-being of parents called Parents Under Pressure that was released last fall of 2024. The advisory calls attention to an urgent public health issue, which is the crisis and the unique stressors that are facing parents and caregivers of different types across the American workforce. And the advisory provides recommendations for how it should be addressed. It was really wonderful to read this and to resonate with so many of the issues that are facing parents and caregivers today, and those defined by adults taking care of children under the age of 18 and or older adults. And the advisory calls attention to the importance of parental stress, specifically mental health and well-being stressors unique to parenting and the bidirectional relationship between parental mental health and child outcomes. And we know we have significant data we'll talk about here today linking those two. So what are these unique stressors that parents and caregivers experience from raising children? We're seeing highlighted by the advisory that financial stress related to childcare costs, health and education expenses, employment and income insecurity can all be contributors to parental stress. For example, in the last decade, childcare prices have grown by approximately 26% in the US. And there have been studies to show significant association between, for those in poverty specifically, facing food insecurity and linkages to symptoms of parental depression, anxiety, and stress. For those of you that know, if you know, you know, time demands are some of the most significant stressors facing parents and caregivers today. And that's for two primary reasons. Parents are working more and they're parenting more. The average that parents are working or the adults are parents are working has increased 28% since 1985. And the time spent in primary childcare has also increased by 40% from 8.4 hours in 1985 to 11.8 hours. So with that, we're between working more and parenting more, we're facing significant burnout and stress and mental health issues. The health of our children has also been an issue that we're facing increasingly, specifically with 3 in 4 parents extremely or somewhat worried that their child will struggle with anxiety and depression. That's coupled with concerns around children's safety, including being bullied at school, as well as the worry and concern around school shootings. The issue of isolation and loneliness is something that has been often ignored in the literature and the studies and research around parents and caregivers, but recent studies have shown that 65% of parents and guardians And 77%, and that's important to note, just the disproportionate impact that single parents are facing and related to isolation and loneliness, experience loneliness, and this is compared to 55% of non-parents. And we all know, as we see almost daily in media and what we experience in schools and sending our kids to schools, that parents are really worried about technology and social media. 70% of parents are saying parenting is now more difficult than it was 20 years ago, and that's in large part due to children's use of technology and social media. Lastly, the expectations of parenting and caregiving have changed. So with this modern practice of time-intensive parenting and contemporary expectations around childhood achievement, we're all faced with a number of stressors and burdens that parents and caregivers are experiencing. And we see this come through the data. According to 2023 data, 33% of parents reported high levels of stress compared to 20% of non-parents or other adults. And we have almost half of parents saying that most days their stress is completely overwhelming compared to 26% of over adults. So the numbers and burden they're significant. There's approximately 63 million parents living with children under the age of 18. Nearly 30 million of these families with children under 18 had at least one parent employed. And what we saw through the COVID pandemic is that number of these challenges facing all parents and all caregivers significantly and directly and disproportionately impacted women in certain sectors and in low wage industries and jobs. I want to point out here the acknowledgement that we also have a sandwich generation. So nearly a quarter of US adults in 2021 had a living parent age 65 or older, and also were caring for a child under the age of 18 or an adult child for whom they provided financial support. This all leads to the stressors that I mentioned, as well as what's been discussed and studied around emotional labor. And we see certain jobs, including healthcare, caregiving and nursing facilities, where a lot of women entering workplaces that are previously male dominated are finding that they're expected, by virtue of being a woman, to provide an added shift of emotional labor. So I'll ask all of you right now, and you represent a really diverse group of participants, whether it's your role in an organization to be focused on employee health, whether you're personally an employee that can relate to this and has perspectives. Do you feel that your workplace could do a better job supporting parents and caregivers? We'll give you another few seconds here, and then we'll pull up the results. All right, so about 65% of you said yes. The majority of you said yes. A very few of you said no, and then about 30% of you said maybe, not sure. And I think that that's going to lead to a really good discussion with the experts that we have invited to speak today. And these experts include distinguished speakers across research, policy, employee health, and journalism to discuss these critical issues facing working parents and caregivers today. I'm pleased to introduce Dr. Ellen Galinsky, our keynote speaker. who who is the president of the Families and Work Institute and the elected president of the Family and Work and Family Research Network. She also serves as senior research advisor to AASA, the School Superintendent Organization. Her research focuses on work life, child and adolescent development, youth voice, childcare, parent-professional relationship, and parental development. Ellen is also a best-selling author. Her books include Mind in the Making and The Breakthrough Years. Welcome, Dr. Galinsky.
Thank you so much. It's a huge pleasure to be with you, and I will now put my slides up. Here we go. Can you see them?
Sure can.
This works? Okay. I'm going to talk about thriving workplaces, and I'm going to do a time-lapsed view of about 33 years and tell a work-life story that's not usually told. I If you see the painting behind me, it's my husband's. We do time-lapse photography of his making paintings like that, so I've been thinking about time-lapse. You're gonna get ready, let's go. It starts 33 years ago with the national study of the changing workforce, and we did at the Families and Work Institute a nationally representative study that the Department of Labor used to do, looking at what work was like for employees in the United States, and did that for close to 30 years. In that study, we found, as you might imagine, what people are talking about today. People were overloaded by work. They had too many tasks to accomplish at the same time. Childcare responsibilities then and now were very demanding. About 1 in 4, almost, if you look at women, close to almost half of women had primary responsibility for children under 18, but it wasn't just children, it was elder care too. Our definition wasn't just simply that there was an elder in the family, but it was that you were doing things for them that they couldn't do themselves. And we found that 3 in 10 employees expected to provide elder care in the next 5 years. And the issues of conflict were high, interestingly enough. Starting in 2008, men were reporting more work-life conflict than women. We can talk about why, because women were doing more of the work and more of the personal responsibilities, but it was a new role, and men were experiencing this pressure as high. This is a seminar on health, and we looked at depression, we looked at health. I'm just sharing health, but 23% of US employees at the last survey that we were doing showed 2 signs of clinical depression, which would mean that they should be referred for screening. We continued then to look at what employers were doing in response, beginning actually in 1998, but the study then, we did it almost every 2 years, looking at both workplace policies and trends, but we also looked at issues facing employees, and it wasn't just employees who were feeling pressure, it was also employers. It was more difficult to recruit people in the past. So our question was, and remains, what can we do to make work work? And that to me was a very important question, because work shouldn't just work for the employer, it needs to work for the employee as well. And we had a data set with 610 items in it. We could do regression analysis and look at what predicted things that mattered to employees as well as to employers. But importantly, we also, I said civic science, and we started with an acknowledgement of native land. Civic science means nothing about us without us. Basically, that the people who are the subjects of your study become their co-creators. And so we ask employees about what was working for work and what wasn't. And it wasn't just having access to programs and policies. It was things like how your supervisor handles it when you have a work-life emergency. It was whether you have the schedule flexibility. You might have access to flexibility, but it might be rigid. It wasn't just satisfaction with work, with wages and benefits. It was also how your coworkers treated you, whether you were in a job that challenged you and gave you learning opportunities. Supervisors supported you in being successful. You had some say, and a culture of respect and belonging. And we then partnered first with the Chamber of Commerce and then with SHRM for about 10 or 11 years, and worked with about 5,000 employees to take these ideas about an effective workplace and to survey employers, compare them to national data, and to other applicants, and look at what makes work work and share some of the best ideas. But then the pandemic happened, and that made us relook at our data. We had measures of what happened for people, um, the kind of things that happened during the pandemic in our data set. About 50% of employees experienced one of these adverse experiences, the kind of experiences that happened during the pandemic. And we then created a new index that looked at, again, workplace support and belonging, participatory decision-making, culture of respect and trust, and a whole employee approach. That is, seeing the employee not just as a worker, but seeing the employee as a person with family responsibilities. And what I want to say now is the Surgeon General's report I just loved, but he left out work itself, and or he and his team, because I know I know the team that created it. Work itself makes a big difference on people. It's not just time demands. It's not just managing work and family life. The kind of job you have matters. And what this particular chart shows is it looks at health, because we're talking about health today. And it shows in this figure that if employees were high on meeting those four, did well on those four different aspects of the job environment, the work environment, it reduced the differences between people who had an adverse experience and who didn't. So the work environment makes an incredible difference on people. And then in the meantime, I do studies of work and family life and kids development, and I had moved from early childhood, as you said, Lily, into teenagers, and also using civic science. And in those studies of the breakthrough years, I found that when you look at which teenagers are thriving or which aren't, they were experiencing, the things that mattered in the work environment were similar to the things that I had found for decades. Um, for teenagers were things that I'd seen for decades in the work environment, like did they have caring connections where they felt that they belonged, felt safe to be who they were, felt that they were supported? Did they have some agency where they had autonomy and were treated with respect? This is teenagers. Did they have some mastery where they both were challenged but could feel and could become competent and could be who they are and could find ways? Purpose means finding ways to contribute back, which is really self-determination theory plus the notion that people have basic psychological needs, and if they're met, they're going to thrive. Physical needs, food, water, and shelter, but these are psychological needs. I've expanded on self-determination here and could test it in my study. And I didn't know when I did the first nationally representative study of teenagers 9 to 19 and their parents that a pandemic would happen, but I could go back 9 months later in the height of the pandemic and look at teenagers who, for example, felt that they belonged, and these are just three of the many items we measured in terms of were they their psychological needs. Were they challenged, and did they also feel competent? And what you can see with those arrows is when these basic psychological needs were met during the pandemic, these kids were doing and met by relationships, by their family, by their friends, by their people in school and out of school activities and online. These kids were actually doing well during the pandemic, both at school and at life and in their psychological health. So that made me revisit our findings, and I went back to look at those decades of research that I did on the workforce and went, whoa, the items that really popped in our studies before were things like, I feel a part of the group that I work with. And that I began to think of, well, maybe we're missing something in looking at the work environment. We're missing the importance of relationships. So we developed a survey that was really similar to the survey that we had done with teenagers. And we're trying it out now with staff and Head Start programs. We're doing it in the state of Nevada with a whole agency that supports children and families for as well, and other places. And what we created a survey that looked at, to what extent did the relationships at work meet people's basic psychological needs. And we shared the findings with Head Start leaders in this pilot. For example, we looked at job retention. Here is a question that we ask about job retention. Will you make a genuine effort to find a new job? And what we found was that even though the Head Start people had similar programs, similar policies across these programs that we looked at, you can see that 16% were likely to make a genuine effort to leave when their psychological needs were met, but 55% were if their psychological needs weren't met. We're talking about health, and we ask a series of questions about stress and health and well-being. And the same thing, there was a variation between programs, even though they might be paid the same salary and have similar benefits because it's a federal program, that there was a real variation. And this slide shows that when psychological needs are met, this is a correlational slide, that that these adults in Head Start workplaces were less stressed, were more likely to be satisfied with their job, with their life, were more engaged in their job and less likely to leave. We also created 2 open-ended questions, which we ask, if you had one wish, just one wish, a question that I've used with kids in my studies and adults in my studies for years, as Josh, I think, knows. What would that wish be to improve your workplace, to make it a more thriving workplace? And then we ask another question, if there are any issues. This question came from civic science, but they suggested we ask it, what are the things that are going on that you really don't want to tell your supervisor? These are anonymous surveys that we did. What do we need to know about your organization that you won't tell other people, but that could make it better? And then we launched an autonomy supportive process. So often at the workplace, employers fix things for employees. But we know from the research that we've done on human development, if you have some say over your work, we found this in our workplace research for years, you're doing better. So what we did was we have teams of employees and employers in both places. Work has to work for both, where they select a problem or issue, mostly that come from their open-ended questions. And then they generate as many solutions as possible. They consider the they consider the pluses and minuses of each potential solution and pick one to try, and then see it as a change experiment. If it isn't working, they try it again. This is having an amazing impact because our hope is that it will improve the health and well-being and stress, and we're testing that. Depression that was pretty high in these Head Start programs among staff, and retention programs. If they begin to come up with solutions to make their workplaces more thriving, they'll be better. So what I want to say is that workplace policies and benefits are absolutely necessary. They're really crucial, but we found by doing civic science research that they're not sufficient. If we're really going to combat parents under pressure, we need to consider relationships at work. We need to consider autonomy at work, some of the things that I've been talking about. And that's something that each of us, whether we're the boss or a coworker, can address. I was privileged to listen to the Surgeon General in his parting address to his staff. And what he said was, as I finish my tenure as Surgeon General, this is my parting prescription. My final wish for us is choose community. And by community, he means relationships, he means purpose, and he means both building a better place to work. So as we look at programs and policies that we might develop, we also need to think about what Fred Rogers, I was Fred Rogers' expert on his Mr. Rogers Talks to Parents programs, always said, one kind word goes a long way. Thank you very much.
Thank you so much, Ellen. That talk hit on so many themes that we're going to discuss with our two additional guest speakers today. I'm going to introduce Tani Espinoza, who is the Chief Development Officer at Community Hospital in Grand Junction, Colorado. She has served local employer groups managing their clinic network agreements and wellness programs to improve access and reduce the cost of healthcare. Tani oversees the occupational medicine department and other value-based projects. She works to develop strategies that enable hospitals to better serve their communities. And since 2018, she worked to build an on-site childcare center, which opened in September of 2023. So awesome. Also joined by Josh Leves, who is a broadcaster, journalist, and host of They Stand Corrected, the podcast fact-checking the news. Thank goodness. Topics he has covered include modern fatherhood and how the reality of today's men conflicts with stereotypes about masculinity. Josh spent 20 years on NPR and CNN, where he became lead on-air fact checker. He has won Peabody and Edward R. Murrow Awards, as well as awards from the Society of Professional Journalists and the National Association of Black Journalists. He's also an author. His book, All In, Busting Myths About Fathers and Pushing for Gender Equality, was published by HarperCollins and won the Nautilus Gold Award for promoting positive social change. So we have Ellen and Josh and Tani here to discuss some of the questions that I'm interested in and that really start to bridge into what you presented, Ellen, around the issue of having access versus having the culture, the support, the supervisor support in those interpersonal relationships within a workplace that really make us as individuals in times of higher stress and times of need be able to seek the support we need and maybe take that time off. So I might be an individual working, I'm checking the chat as well, with everything right on paper, right? I have access to great sick and vacation leave. I have paid parental leave. But we're seeing that not a lot of the eligible employees that have access to those benefits actually take them. And the question is why? And Ellen, you got to this, right? And so my first question to open with for you all that draws on your experience and your research and your perspectives, Josh, I want to start with you, is how can employers create a culture that normalizes caregiving responsibilities rather than stigmatizing them, making us feel guilty?
Yeah, no, I appreciate that. Look, as you all heard, I came at this from a position of being a fact checker. And what happened with me was that I became a dad at the same time that I was doing all that work. And I started to see all these problems. And then I had this battle for fair parental leave, in which traditional dads, could not get the same leave as everybody else. And I saw how the structures were designed to prevent certain things from happening, things that were literally built in the Mad Men era. Like that's where these structures came from. So I went off on this exploration to figure out what works. And what I do when I work with businesses everywhere is I show them the facts, what works. So big picture, three structures need to be tackled: the laws, the policies, and the stigmas. Laws, we need the kind of insurance programs for paid leave that exists in lots of states right now. We need it on a national level. Everyone should have it. It's overwhelmingly popular. It boosts the economy. It keeps more people working, which is, part of what we should be looking for. And it helps businesses. They don't have to pay people while they're off because there's this insurance system in place. Second are the workplace policies. And what we need to have is specific caregiving leave. Part of what came out of my legal case was the Equal Employment Opportunity Commission, the EEOC, sending out guidance to businesses saying you have to separate maternity leave, which is physical recovery leave, from caregiving leave. Now, that has broad implications because first of all, it means that anybody can get caregiving leave without having to fight for it. Today, among full-time workers, 44% of caregivers are men, according to the latest figures. So it becomes available to everyone. But also, caregiving leave is usable for anyone, for all of the kind of caregiving we do. As you said, sandwich generation, we could be doing that with anyone. And then the third big structure tackles your question, and that is the stigmas. The stigmas are very powerful. Nothing is more powerful than the stigmas. A lot of work, someone just wrote paid caregiver leave is the gold standard. Not only is it the gold, I think David, yeah, not only is it the gold standard, but it is actually a draw on employees. So when businesses start to do it, they discover that people will work there. But tackling the stigmas is the biggest problem and the biggest need. We have to get past the idea that having caregiving responsibilities makes you any less good an employee. And what I do is I explain this to businesses, and then I'll pass it on. We have this old idea of what a great worker looks like. We used to think that a great worker is someone who sits at their desk for the most hours. And what I've shown businesses is if they set aside all that and instead choose a metric, a month, a quarter, a year, go back and look at who did the most for your business. It's almost never the person who sat at their desk the most. And often it is someone who also has caregiving on the outside because they're great at multitasking or they work at off hours. When you just weed out these old ideas of what work is, it's not a place you go, it's a thing you achieve. And you start to measure based on that, then you normalize the reality that caregivers are some of the best employees you can have.
Thank you, Josh. We're going to come back to your Mad Men era example and why drawing on some of that, as you mentioned, has resulted in what we still expect as a society in a lot of our workplaces today.
Yep.
Tommy, how about you? What are some of the ways you think we can develop a culture, establish a culture that really normalizes caregiving?
Yeah, so being a hospital, obviously we are a 24/7 operation, right? And so that has some significant challenges when it comes to parents because, and especially during the COVID pandemic, when everybody else kind of was shuttering themselves inside and staying at home, nurses and doctors and, those of us in healthcare didn't have that as an option. And so caregiving and providing a place, a safe place, a high quality place for our children to go so that we could still provide the absolute best and highest quality care for our community became of the utmost importance. And so, as you noted, we decided to take it head on, and our community is 4,000 slots short for childcare. And there is no way that we can recruit and retain high quality healthcare professionals without high quality childcare places and providers for our kiddos to go so that our employees can continue to come and take care of all of us. And so that's really what we did. But then to your point of it's not just about childcare, it's about all of the other ways that we are providing that care, whether it is elder care or neighbor care, or, even taking care of each other in a workplace, right? We know that kind of building each other up and asking each other how we're doing and taking care of those stressors. We're all caregivers and it impacts all of us. And I think, initially when I said I was going to build an on-site child care center, we're a non-for-profit hospital, so we don't have huge coffers. We raised 100% of this to do it. So we raised $5 million to build our child care center. But I did get some people who were like, well, I don't have kids, so what's in it for me? How is this fair for me? But when we think about the burdens of being a caregiver, and if someone is having to take care of a sick kiddo or their parent or whatever spectrum you're on, somebody else is having to cover that. Somebody else is pulling a double shift or we're working short staffed. So caregiving in that most basic sense is impacting all of us, even if we ourselves are not the caregiver.
I think that's spot on. And we've had the question come up in the chat about what can be considered for all caregivers, including those that are taking care of elders, those that are taking care of sick friends. And so I think that really hits on how to start to normalize that across all employee populations. Ellen, you talked about the work itself and and not just that individual worker, what they need to be experiencing. I think the access to resources we have outside of work really influences how we juggle work and caregiving. And so I want to ask you first, what policies and benefits have you found in your research to be most effective in supporting working parents and caregivers? You got at some of this around, it's not just access, it's relationships. Are there some specific examples you can point to?
Yes. Let me say that one of the things that we found, and again, I said we worked with about 5,000 companies to improve their work environment, was that you need to know who the customer is. In other words, you need to know who your employee is, what they need, what the resources are, so that where an on-site childcare might be great for one employer, it might not work at all for another employer. And so I think that the first thing is that you need to know your employee. Improving community resources is also something that's really important. But I think there are things that we can do to improve relationships ourselves. It's really up to each of us. When we looked at what works about work and what doesn't, it's often the way coworkers talk to each other. It's not just the boss or the boss's boss who's in charge. It's the culture in the workplace that makes the big difference. The companies that really handled this well would change their credo, their business statement of ethics. They'd make a statement that this is something that we value. This is the way we make business decisions. And then they would often train their managers in understanding and responding, because we've seen companies over the years that could have great programs and policies, but no one could use them because there was a stigma. So, and we found the stigma in all the years that we measured it was flatlined. It never changed. It wasn't just, it went from the 70s, it wasn't even from the time that these things were being measured on. So the entrenched idea, it really comes down to how you view people. Do you view people as basically going to cheat you and take advantage and be a lot of losers and cheaters and that sort of thing? Or do you think that, yes, there's some people who may do this, but most people won't, most people are good? And so behind all of this is a basic view of people that seems to govern their decisions, and that needs to be changed if you're going to have a more effective a workplace that's thriving. And I think you need to look at the health, because we found physical health repercussions of the work environment, of not just the programs and policies, but of the work environment and of the work culture.
Thank you. Tawny, I want to know what, from your work, your tenure, what's working, what's worked around providing benefits and policies at the hospital, and also noting that you are addressing an audience where there's not a whole lot of autonomy, right? A lot of people in the healthcare industry aren't able to have flexible work arrangements. So how are you supporting working caregivers?
Well, I'll go back to the point that Ellen just made, is it's building those relationships and having those conversations. And I think the absolute most important thing we can do is just open that dialogue. And whether that's in our one-on-one meetings or our staff meetings, it's having the courage and the ability to voice challenges you personally may be experiencing. Gosh, this 8 a.m. meeting is really hard because I have to drop a kiddo off, right? If we don't speak up ourselves, how are those around us then able to come in and provide that support? So we have to first be willing to speak up. And it's then being able to say, we can't be fair across the board with every single person, right? Some can work from home, some can't, like I just was saying, right? Physicians, nurses, you can't provide care from a bedside when you're at home. Some things just have to happen in a hospital. But again, if we're able to say, can we, move your schedule around? Can you come in later? Can you stay later? Can you work in different hours? Because to Josh's point, the work doesn't necessarily always have to happen between 8 to 5. And that's what we know at the hospital, right? We're 24/7. So perhaps billers can come in later. But without having that transparency and the honesty on both sides, where the supervisors first have to believe the employees aren't necessarily trying to take advantage of them when they're advocating for themselves. And the supervisors, are needing the employees to say, here's how I can create a structure that works. And so, one of the best things a supervisor ever told me is, if you're going to come forward with a problem, back it up, come right back in behind it with a solution. So if you're saying that 8 a.m. isn't working for me, what does then work, right? Don't put all of that then on your supervisor or the rest of the team to come up with the solution. Kind of come in and say, well, maybe we can create a co-op, or maybe we can do X, Y, and Z. And so I think it's really being willing to start to look outside of the box and create benefits that work for all employees. One of the things that we've done around this culture is, not everybody needs health insurance, right? So how do we create this culture that our benefits are also working for everyone? It's not just about childcare, but maybe some of us don't need dental insurance or vision insurance or whatever that looks like. And so it starts to become this much broader conversation of, how are we taking care of our employees across the entire spectrum, and how do we add value to their lives so that they're able to come to work in the best absolute place, condition, health that they are in, so that they can then in turn, right, consider to take care of, to turn that and take care of others. And so for us, it was a much broader approach. Childcare was one component of that, but it truly is how do we continue to serve our employees so that they are able to be their best selves?
I think that you have some amazing examples that we can also share with this audience. Josh, what's your perspective? How you have anything to add on what works, and specifically how workplaces could be focused on a more inclusive approach?
Yeah. So first of all, when we start talking about this, I always keep in mind that business leaders are under tremendous pressures as it is. Everything's constantly in flux. They are so stressed out. I work with CEOs in my communications business, and they're all stressed out about a million things right now. And it's easy for this to fall off the radar. This is why I say the first thing is the laws: national paid family and medical leave. That relieves businesses from having to do it. And it's so silly that in our culture it's even up to businesses. Like, it's not up to a business where I send my kids to school. It's so messed up, but it's up to each individual business how I take care of them in this way. But it is, because that's how it's structured. But when you have a national plan, it helps a lot. And then making sure that the policies are truly gender neutral and apply to all forms of leave. That is essential, because you will be taking care of different people at different times. And for people who say, I don't have anyone to take care of, well, as a rule, these policies are for paid family and medical leave. At some point, you could get sick and need to take care of yourself. Plus, almost everyone will take care of someone at some point. So, having a policy at all is crucial. But then tackling the culture, this is where I come into organizations and I do kind of the cellular work. I think of it as changing the DNA, because part of what we need to do is weed out the sexism. And there's a lot of sexism still. As you said, want to come back to the Mad Men thinking. I joke that the early businesses of this modern era were designed around work-life balance, but the balance was the men do all the work, the women do all the life, and that was never realistic. So inside these organizations, having anonymous surveys, having ombudsmen or ways for people to report when they have problems, and having people who are empowered to speak up when anyone is pressured out of taking caregiving leave or putting to use the benefits that do exist. When you have the option of benefits, the next step is making sure that everyone is confident and safe, career safe and psychologically safe, but just straight up career safe, to use them. And that's what you find out from people who complain, from people who fill out anonymous surveys, from people who go to Glassdoor and say, well, sure, we have this policy, but if you used it, you got fired. So there is this multi-stage process in which you make sure the benefits are there, and then you make sure that everyone feels empowered to use it. And that involves training from the top down, too. Like, I do managerial training, in which it's crucial to help managers understand that if they get their underlings to take the benefits that are there, their underlings are more likely to stay. And the cost of replacing an employee can be 200% of annual salary. So losing them for 4 weeks or 6 weeks to caregiving is nothing compared to replacing them. So these are the kinds of things in which educating people based on facts and counteracting the stigmas allows all of these nice corporate promises to become real.
I love that. And I think some of this is still it's still a bit lofty when it comes down to individual situations, right? So for example, you want to be able to provide leave. How are you going to ensure that when someone returns from leave, they have the support they need? I'd like to hit on that, Ellen, if you could, in as far as across the board, we're talking parents, we're talking employees caring for aging parents or family members with disabilities. What can workplaces do to support those coming back and making sure they're not coming back to, piles and weeks of work? What can we do there?
Well, two things. One is that individually, uh, companies can set up networks of people who have come back from leave and look at their supporting each other so that you get the kind of the support. Some companies, increasing numbers, have people whose job it is to help create that transition back from whatever the work family issue is. But I wanted to see if we've got a lot of going on in the chat about return to work and
Yeah,
companies. Is it okay to begin to
please.
talk about that?
Yes.
Yeah. So I've just been watching the chat buzz up about the return to office policies.
Mhm.
There are employers making them increasingly. They're making them because they believe that there was abuse during that time. Unfortunately, HR should have been documenting whether or not there was abuse and been dealing with that on an individual rather than everybody is bad kind of a basis. You're absolutely right that people are more productive if they have some sort of flexibility. The companies that have handled this best have worked with employees to figure out how much time do you need to be in the office? How much time can you be at home? You can usually find any job in healthcare anywhere else. I don't mean not necessarily being a nurse, but there are ways that nursing companies have handled, and staffs in hospital have handled this so that people can also have flexibility. And and then figure out, the complete return to office is not, people are doing it. Don't, I read it in the paper all the time. I know my friends who are experiencing it. But it's not necessarily, you're going to get them in there in body, but not in spirit. And what companies that really want to keep the engagement of employees high, and engagement is a proxy for productivity, is that they can figure out a way to problem solve so that the essential work gets done. And then it goes down to the team level too. Teams can figure out how to help each other because pretty much everyone has a work family issue at one time or another. It's not just people with children. And so, there are levels. There's policy, there's, corporate policy, and then there's individual team practice. And the team practice is really critical to making work work.
I appreciate that. I want to ask one, I'm going to couple a couple of the questions in the Q&A and start with you, Tawny, for our last question here. There's been a couple of questions around how do these recommendations scale to all employers, whether that's the small employers that don't have an HR department, whether it's employers that have a really diverse workforce, and you mentioned the personalization and customization approaches. So can you give an example of how to get that information, and how often do you collect that information to be able to really get a good pulse on what every individual worker needs, and how you go about approaching that for your workforce specifically?
Yeah, so we did gather survey data on our workforce and what we were needing. And I think a survey is a great place to start, right? Gathering the information that what everybody is needing. And it gives, to Josh's point, if it's anonymous, right, where you can speak up and start to kind of say, here's what we might need. So I think that's a great place to start. Start with data gathering, start with opening those conversations, whether that's an anonymous survey, focus group, at staff meetings, and I would suggest doing all of it. Because the more that you're trying to gather information, the more that the workforce starts to feel like, oh, they are taking this serious. If you just do a survey once and then put it on the shelf, nothing changes, and your employees are right back where you started, where they believe like, oh, they aren't really going to care about these issues. And so obviously that type of information gathering can scale from small employers into large. We have a wide variety of employee types. You know, I certainly mentioned nurses and doctors, but billers and coders and food service workers and our environmental service workers, and they all are needing different things. Some will need night shift coverage, some are needing other things. But when we start to look at this and you consider, you know, perhaps there's oil and gas, right? Where spouses are 3 weeks on, 3 weeks off. So this idea that we're all needing coverage in one way, shape, or form, it's a snow day, a sick day. And so we really have to start to get creative about how we scale these, not only in terms of, you know, whether we're small or large employers, but also how do we scale these for different types of work, for different seasonality, different industry, and getting creative within those spaces as well. And to say, you know, do we have to pay for childcare for teachers when they're home during the summer, right? And so how do we start to look at some of these other challenges across industry, across these other spaces, to say, okay, what does this employee need at this specific period of time? And perhaps a solution that works for somebody today may not work from them a year from now. So this is an ongoing conversation. It never ends. I always, you know, when I talk about childcare issues don't go away the second your child hits kindergarten, right? So it has to be an ongoing conversation throughout the entire lifespan of that employee, and continuing to ask them what they need in their current state for whomever they might currently be caring for.
Thank you, Tawny. Ellen, we found in our research that in some cases, and often cases, the small to mid-sized employer actually has more flexibility to do this because they don't have as much bureaucracy and decision makers to go through. Would you agree?
We worked, those 5,000 companies that I'm talking about were small and mid-sized companies. We also work with the IBMs and the Johnson and Johnsons and the, you know, the Goldman Sachses, but we worked with small companies. And yes, you can get together. I want to go back to the shared solutions process that I
Yes.
talked about. The survey that asked, what if you had one wish to improve your workplace to make it more thriving, what would it be? You can collect those autonomously. We are in very small Head Start staff. Those are not big organizations. The stories were just like the stories I'm reading in the chat. What's different about what we're doing, and I'm really excited about it, different from anything I've ever seen, is that it's not just employers coming and fixing it for the employees. Employees are getting in there. It has to work for the employer and the employee, but they're having some say in creating the workplace that they want to get up and, you know, be at work at every day, whether they work at home or not. And I think that that's going to really make a workplace that can work for both employers and employees, and where we can both be productive and have the kind of family life that we want to. And let me just tell you, as a grandmother, it doesn't go away even when, you know, I get a call, my grandson is sick, you know, mom, come help.
The perfect example of the life course we're dealing with. Josh, I'm going to give you a last word. What's the one thing you want everyone attending this webinar to do when they take this information back to their jobs?
I want you to feel empowered. And I always say, start with the presumption of best intentions, right? Like instead of going in like here I am, someone who launched legal action against Time Warner. So that surprises some people, but start with the presumption of best intentions. That's what I did. Take a look at the policies, take a look at the culture, speak with the people who are in charge and say, look, I have all this information showing that if we improve this, it would do a lot better. Could we try it? And then see. And you might find that they're like, okay, yeah, you know, have those conversations in the workplace and look around you and see if there is someone who never talks about caregiving responsibilities because they feel stigmatized for it, especially guys. A lot of guys will never bring up their caregiving responsibilities in the workplace, even though they have them and they are struggling with this kind of tension between, you know, work and life, work-life conflict, which is a real scientific thing, not just a concept. So The more that you feel empowered to start conversations with HR, with your bosses, with your colleagues about this and bring solutions to the table, this isn't just me being pie in the sky. The more likely you are to achieve real, productive, pragmatic change. And only if everybody shoots you down, then you have to take the next step and become a little bit of a rebel inside the workplace.
Well, let's take that all to heart. I think we are walking away with a lot of good takeaways and actions that as researchers and as practitioners and as leaders in total worker health and workforce health we can do. And that includes expanding policies, training, looking at access, and also remembering to take care of ourselves as caregivers and thinking about how we can not only access some of the benefits that we have and advocate for better benefits and policies within our workplaces, but number two here, which hits on your take home point, Ellen, which is in nurturing these connections across the workplace. So David, I'm going to send it back to you. I want to thank everyone. Thank you so much to our panelists, Ellen, Josh, and Tawny, for your expertise and information. Thanks, everyone. David?
Yeah, thanks, Lily. For those of you that are hopping off, the survey for continuing education credits should pop up upon leaving. It is also in the chat function. Our next Health Links webinar is on heat stress in the workplace on April 16th. So we're eager to have this conversation about the impact of heat, especially on outdoor workers with some of our colleagues around the world. Thank you so much, Lily, Josh, Tawny, and Ellen for this conversation. Whether you know it or not, I consider most of you to be mentors and really key experts in this field. I've been working on family-friendly workplace policies for the better part of the last decade and have really drawn on the support and research that you're sharing here today. So we really appreciate such an amazing discussion with such great representation. We said in the chat here, please take care of yourselves right now. Things are stressful. We understand that. I appreciate being part of a community that shows up at these webinars and has these discussions. So community is caring, and take care of yourselves and your community at these times. And just thanks again, everyone, for participating. We hope to see you again in April.